This morning on today's checklist, a condition that could be quietly causing trouble inside your body. Some surveys estimate 1/3 of Americans are dealing with chronic inflammation. Doctors say it could cause problems with everything from your gut to your heart. NBC News medical reporter Dr. Akshay Syal. I knew it was coming.
Bang! Yes!
That's karma. Just asked you, and I knew Al was watching over my shoulder. Anyway, hello, doctor. Nice to have you here.
Thanks for having me.
Let's start with what inflammation is exactly.
Yeah. So I'm so glad we're talking about this, right? It's one of the hottest topics in medicine, and it's frankly something that my patients are asking me all the time, right? You know, they come to me and they say, I don't feel right? I feel tired all the time. I had a patient, Dylan, just ask me, why does my body feel like it's on fire from the inside, right? It's a little bit wild. And so, what is inflammation, right? So put simply, inflammation is the body's response to an injury or an infection. And it can be good and it can be bad, right? There's acute inflammation in the short term, and then there's bad inflammation, which I'll come back to. So when we talk about acute inflammation, think about, do you ever go running and you sprain your ankle and it gets really swollen and red?
Yeah.
That's acute inflammation,
okay,
right? That's good, and we want that. Chronic inflammation, though, Dylan, is inflammation for months to years. And we often call it silent inflammation because people may not know that it's going on, and it can cause a lot of problems in the body.
Okay, which we'll get to.
So how dangerous is that kind of inflammation, Doc?
So Al, all parts of the body can be affected by inflammation, right? Think about arthritis, inflammation of the joints, or eczema, inflammation in the skin. I think a lot of us know, people with appendicitis, inflammation of the appendix. But we've highlighted a few areas here, Al, which I think a lot of people may not necessarily associate inflammation with, right? So we talk about our hearts. Right. Talk about the plaque in the arteries of the heart. That's actually a low-grade inflammatory state.
Really? Wow.
Yeah, and a lot of people don't know that plaque can burst because of inflammation and cause a heart attack. We talk about our lungs. Asthma, COPD, chronic obstructive pulmonary disease. That patient I just mentioned who told me her body felt like it was on fire. We think it's actually her asthma that's driving it.
Wow. Oh, wow.
Right.
The digestive tract?
Digestive tract, people with, bloating, indigestion, maybe some diarrhea, can be from low-grade inflammation. And then finally, my favorite organ in the body, the brain. As we get older, we think inflammation can actually cause memory loss, linked to dementia and Alzheimer's disease. And as you can really see, inflammation can affect all aspects of our health, Al.
All right, so to that end, Doc, how would someone know if they had chronic inflammation? Are there symptoms?
It's a $1 million question, Craig. It's what everybody comes to me and saying, can you test me for inflammation, right? So when we talk about signs of inflammation, there's certain things we look at. The most common one I see is fatigue. Right? People tell me they're tired all the time. And I don't mean, tired after running a half marathon or a marathon. That's normal, right? That's okay. But what I mean is maybe you can't do things that you used to, right? Some people say, oh, I'm just getting old, right? It's okay, I'm just getting older. Maybe not, right? We may be missing something. We talk about digestive issues, the bloating we talked about, the diarrhea, achy joints, right? Some people can have, chronic pain, whether it's in their hands, their knees, their elbows. Weight gain, obesity, Craig, is actually associated with a low-grade inflammatory state. So those drugs like Wegovy and Zepbound, those injectable weight loss drugs, we actually think are lowering inflammation in the body.
And frequent infections as well.
Frequent infections, yeah. People with sinus infections, UTIs, if that's happening a lot, definitely bring it up with your doctor. There's more tests we can do about it.
Well, we have about a minute left. I'm so happy we're doing this. I'm telling you, people like me, I'm like, I'll take some turmeric tea. Like, I'm just trying to figure out what you can do to try to combat chronic inflammation. What would you say? So
Chanel, regular exercise is extremely important, particularly cardiovascular exercise, right? Getting moving can lower inflammation. Balanced diet, limiting those ultra-processed foods, right? Fast foods, things like sausages, bacon. You really want to cut down. Make sure you maintain that healthy weight, as we talked about, because obesity can cause inflammation. Okay. And finally, cut back on drinking.
You're in trouble.
I know. It's
no, but it does. You know what? I think, but it catches up to you, doesn't it?
It catches up to you, not only because it causes weight gain, but the alcohol itself can cause some low-grade inflammation as well, guys.
I think it's a great segment.
We learned a lot.
Very good.
Yeah. Thanks for having me.
Thank you.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.